Uh, Good afternoon, everyone. My name is Saddam, and I'm from Manipur in Northeast India. Basically, in this context, I was told to speak from the angle of the personal experience which we have in India, and not from the experiences from other countries. So, Dr. Carroll had left India also. So, I will be speaking from the perspective of what I have faced, my experiences, or my story. Basically, we have already talked, Dr. Carroll had already talked about what chemsex is. When we talk about chemsex, there are certain things which comes into our mind. So finally, I was struggling with drugs. I'm a queer person. I identify myself as gay, and I use drugs. And I am a person living with clinical depression and anxiety. So there's, from the starting itself, from the morning itself, we have been talking about different issues and how we should incorporate the intersectional approach of how different things can be put together, because sometimes there are certain things where we cannot take this topic separately. When we are talking about young people living with HIV, or young people who use drugs, or young people who are living with mental health conditions, or young people who are disabled, or young people who are into sex work. So this was, when I came out, like this story, through this story I only came out because in India when we talk about these things, one is sex. We never talk about sex in schools. So we mostly work with younger population below 35 in the eight states of northeastern states. Our outreach is to the 8 states and also till Darjeeling. So there are two, YAOL as an organization, which is the only queer and youth-led and focused organization in the northeastern region, which is fully run by young and LGBTI individuals, which is the only registered organization. So we started talking mostly about sex, and mostly on substance use, harm reduction, mental health, sexual and reproductive health. So when we started talking about sex among young people, there was so much of hindrance. Then when it started coming to chemsex, these are two separate things which has been very much stigmatized and discriminated. So being a queer person, then using drugs, living with HIV, then who are also into mental health issues, then it's a round of issues, it's a ball of issues which you don't know where to take access services from. So there is a need of intersectionality of queer LGBTI youths, young people who are from conflict zones. I preferably say that there need to be a special focus on conflicted areas, even in India. When we talk about internet outreach or we talk about physical outreach, like Kashmir has been down from more than 100 days on internet. So how do we access there? Like Manipur has been in crisis through certain things on citizenship amendment bill where these issues are considered more important than queer issues, than issues of young people using drugs or LGBTI population. So where do we find our place to talk about issues on drugs, issues on substance use, issues on LGBTI issues, then conflict zones? So I specifically want to focus everyone who is here also on the importance of working in margins. Like without the margins, there is no center. So let's start working from the margins so that you can create the center where all the services should be reached to all the states. And when we talk about chemsex, one thing is it's always related to either isolation or intragenerational trauma or post-traumatic stress disorder when we talk about mental health. Being from a conflicted region, we have this intragenerational trauma where the trauma has been passed down to us by our parents who have seen violence, who have seen conflict. Even us, without seeing anything, we felt this trauma which was passed upon by our parents and grandparents. And another one is a person like me who have had overdoses, hospitalized, got into police custody, who has been like almost turned out from the university for substance use. The trauma that is in my mind, it is still there. I still take medicines for anxiety and depression. I cannot stand here without the medicines. So these are some issues which we definitely need to focus on. And Okay. Here, I'm just pointing out my state. Everybody knows where is Manipur, and I think many of them also don't know where is Manipur. So I just want to point out where we stand. We stand in the Indo-Myanmar border, which is very much known as, which is very much proximity to the Golden Triangle, and also it's one of the states which has the highest HIV prevalence in India. So when we talk about substance use, and again, LGBTI population, for the LGBTI part, that Section 377 has been gone, but the mindset of the people have not gone. Only the law has changed, the people haven't changed. And again, when we talk about the drugs and substance use, it's still a crime. So even if you are using drugs, you are in the possession of drugs, like how I was about to be arrested by the police for using drugs without possession of anything. So there is the intersectionality and the stigmatization around all these issues where we need to talk about, peer self-stigmatization, one. Another one is peer stigmatization, and another one is like stigmatization at different stakeholder levels, like medical stigmatization when we go for services. There's stigmatization at the level of police. When we are caught, we are being beaten there, and we are put in jail without anything, because it's a crime. So it happens at every level, and also when we talk about data, we have been very much talking about data, but I will say that there is no data for people who use substance among queer community. There has been work done in separate, smaller groups. But if we keep on sticking to data and how many people has been how many people has been affected and how many people need to be addressed, if we keep on looking into that thing, then it will become an epidemic soon. Like when we talk about chemsex in India, it's very much in Mumbai, it's very much in Delhi, it's very much in all the bigger cities. But how the scene is changing is that it's no longer limited to the metro cities. It is moving from the metro cities to small towns. Like the price, when MD, like which people use, or MDMA or methadone, these are certain things which people use, but they don't have the idea of what are these substances, what are the composition of this thing. So many people die. Many people die because they don't know what are the composition and what dose should they be using it. And there is no awareness, mostly among queer people, about how to take it forward and how is it harmful, and how, even if people are using it, how can you use it? So there is no data, and even there is data, there is no segregation of data of in what age or in what categories are these people there. So in this part, I would like to focus more on the need of gathering more evidences rather than data, where we count on heads. We should be counting on experiences, like how people are not ready to come. I'm the first person who has come out and speaking that I'm a queer person, I'm a person who has used substance. I have been to all these forums, but no one is ready to come out and talk about substance use. There's still a gap in the society where people who use drugs are not accepted. I'm not focusing on this. So we also have a queer recovery group in India where we have just initiated talking. Like the last meeting was on 30th November in Delhi. It was attended by more than 30 people, but we almost do it in a very confidential way where we talk about the issue in a more way where they feel home. They don't feel like their identity is being revealed, or we need compassion, we need like empathy, we need to listen to the real stories without judging them. This is the first step which we have taken. We have a group called Recovering Together, for queer people who are into substance. So I'm not getting into this thing also, but why I wanted to focus here was there are certain drugs which people are using, and it mostly comes under this thing, stimulants. And when we ask what substance are you using to anybody who use substance, most of them, they don't know. They will say MD, they will say MDMA, they will say something. So there's no information on the substances they are using. Okay, so this was a very common resource where we ask people, why do you use drugs? Or like on other people's idea of why people use drugs. So mostly it's like availability. So if there is so much availability of drugs, then why just don't give it a try? Kind of thing. Then another one is like both. Nothing better to do. Why not have to go when it might be just a fun? Or something about curiosity, like the MD sounds, hyphen sounds very interesting. Why not find out and just do it once? And pressure, where people say that it's because of peer pressure, or maybe sometimes it's protests from themselves, like this is the thing and I want to do this thing. And there are certain reasons where like self-loathing, loneliness, isolation, and many others. But mostly when we talk to more people about substance use among queer community, is that most of them have the feeling of loneliness, isolation, lack of confidence among themselves, and because there's so much of body shaming in the queer community. Like, you are not liked, you have to maintain in a certain way where you should be liked by somebody. And as the queer community itself is very much limited and not open, that you finding a partner, you finding somebody to sleep with, or you finding somebody to have a good time. Like, you have to be in a condition where people should like you. So you keep on questioning yourself of, how am I looking, am I bad? And so in this structure, this substances gives you that confidence. And why people get into these things? That's one of the most common thing. So this substance being a very addictive, and most of the policies and most of the things happening around us has been mostly on abstinence, like say no to drugs. If what I say, I'll say yes to drugs. Drugs has been always seen as a bad substance which affect your body, which affect your behavior. It has been seen from a behavior angle and not from the person's view. Like, you have to just subtract that substance from your body as a person, then only you can understand why people are getting into drug use. If you see the person with the substance together, as long as you are looking that person with the substance together, you are still problematizing the drug use or problematizing that person. So first step is to separate both. Drug or substance might be the problem, the person is not the problem. You try to understand what is going through with that person and why they are getting into substance. So yeah, this has been mentioned already there, that the composition of drugs available are very locally, and one of my friends was also telling, these substances are made sometimes at home as an experiment, because these are substances which are very much available. And yeah, so the chances of health consequences are very unpredictable. Like, I didn't sleep for 3 days. I did, sorry, this is, now I'm like, it looks funny to me now. But at that time when I was hospitalized, like, I have been told to speak more about the personal experience where it has been done. So I didn't sleep for 3 days. I was roaming around all Bombay, like from one place to another, because this inhibits your sleep. And this is something which always say it's more looked from the angle of pleasure, and not from the other angles. So, sorry. So when we talk about harm reduction, in our recovery group also, we are trying to introduce the idea of harm reduction. But again, when we talk about harm reduction, there is this always question that, are you promoting substance use? Are you promoting queer LGBT people to have more sex with the drugs? No. It's very much like, we know this substances are very addictive, and if it's not like I just want to quit it and I quit it the next day. It's like how we try to maintain a thing so that we can at least move from it, or if you are a regular user, if you want to stay within it, how to prevent yourself from other consequences. So it focuses more on, like, the priority is more on the urgent and practical goal of reducing harm of the users, rather than telling them no to drugs. Because the government has said no to drugs, it doesn't mean that I will say no to drugs. The government has said queer people are no more a criminal, but still we get like beaten up, we still get jailed, we still get violated of our rights. Like, there is something in the paper, there is something in the reality. So we are looking towards the rights of human health rights of young people, health rights of everyone. Like when I would like to ask one question here. Like in this room, I just want to see how many people are below 30. Could you please raise your hand? How many people are below 30? 1, 2, 3, 4, 5, 6, 7. I saw 7 hands. So this is a big room. This is a huge room. Yeah. Yeah. So this is a huge room with around 100 people. We have 5 to 6 young population. Like, see, this is sometimes like last time also I referred, where we sometimes forget a younger population when we talk about health. We always forget about adolescents. We always forget about younger people who are below 29 or below 30. So we always say the young people are the pillars of the nation, but where are the pillars? There are no pillars here. Like it's a ekdam khali sa hall hai. So that is one point where I want to focus. We mostly try to advocate with young people. If a young people has to be in room, it should be a meaningful and productive participation. It should not be somebody sitting there and listening to who else are speaking. So there should be a platform like, when we are talking about, there should be equal participation of young people. If not adolescent people, we can always move out from the room and always talk about that issues. So there is very much need of youth engagement and adolescents engagement in India, where we need is. So yeah, again, this is the last slide. So again, when we speak about substance use, there are certain terms which are very derogatory to me. I don't know to others. Like when somebody called me a drug addict, it might be my fault that I have done drugs, but it is not you to instruct that should I be called an addict or a person. Like I don't want to be called an addict. That's fine. But if you ask me, like whenever we talk about queer people, when you talk to transgender person, this case is always the case. When they go to the hospital, to the counselors, the counselors or the doctors, man, most of the times they are very heteronormative. They are very homonegative. They don't even bother to ask which pronoun to use. Like a trans woman coming to a center, if the service provider is calling he all the time, it affects the mental health of the person. Like I identify myself as a woman, then if you are calling me he all the time, then I don't want to come back to you next time. So if you are calling me addict all the time, then I'm not coming back to you again. There are certain terms which you may ask. There's no harm in asking. Like if you want to address somebody, you always ask others' name. Like if I'm meeting somebody, hey, my name is this, what's your name? Same thing. If you don't know what pronoun to use or what terms to use to a person, hello, my name is Saddam and I'm he, him. Just ask. Asking is a very good thing. So, and when we talk about chemsex, the second point which comes out is like chemsex has always been termed as the high. Like it's the high that people like. But no one talks about the low. Low is the worst part. The more you get high, the more you have to come down, because your body has that level of to maintain a balance. So the low is the most difficult part, where I try to commit suicide. I tried to jump down from the 4th floor of my hostel, where my roommate saved me somehow. So this is for everyone. This is the point where you need to talk to people around you, where you should be, every individual as single person, should be a support system to other people when they reach out. First thing is, please don't be judgmental when somebody comes out to you saying that I have used substance. Please don't be judgmental even if you don't know how to respond, just listen. Don't try to fix it, as we always do. Like when somebody comes out with a problem, like you say that my phone is not working, you always try to fix the phone. Maybe it's not the phone which is not working, maybe it's the charger. So we have the habit of always trying to fix things and like see things on our ways that it should be in an equilibrium. So always ask, listen. We are a very diverse set of people with diverse set of minds. So at least try to understand and try to listen to people, ask questions. It's a very good behavior. So, and many people talk about when about substance use is like, why are you not able to quit it? Many people are powerless at that time. Like, I am very much powerless. I don't have any power to do that. Do you think that I want to continue using this drug, affecting my mind, my body? I don't want to die young. Like, as if they asked, like, I can just quit it. You said that you can quit it, do it. Like, you do painting, you do poetry or something, try to divert your mind. I'm already doing so many things. I don't want to do something else again to, pressurize myself. So at least please try to understand that we are very powerless at that point of time when we are in substance or when we really want to quit. And another is like creating a support system and safe spaces, which you can always do. Like if you cannot create a support system, let you be the person as an individual, be a safe space for them to come and talk to you. Like there are so many people that they don't go to anybody to talk about substance use or my problem. I go to only few people whom I think I trust. But when you are being judgmental and you are not giving that safe space and the good vibe, that then you are no longer as a safe space and a person to trust from the next time. Peer counseling at grassroots levels. In Manipur, when we counted, I mostly work on mental health component, where we give peer counseling and all our services are free. We don't charge anything. And we also open a space called Maitram in Imphal, which is the first co-working space which is run by queer people in India. And all the services are free. We don't charge anything from anyone because we know we work with younger population, and if we start charging, they won't come. So creating an environment where they can be themselves. If you want to meet somebody, for example, when I want to meet somebody of my community, or a transgender person wants to meet another friend, like where are the spaces? Either it's a home, sometimes home is not our home. We have been turned out from home. What is the second place? Second place is like you go out to a cafe. From cafe, you have to pay. You have to eat something, drink something. You just can't sit there alone. And also from the people around you, they start teasing you, looking at you, looking down at you, and making fun of you. Those are the certain things which doesn't provide a safe space to people. So the first thing is creating a safe space. It may be a room. It may be the person. Be comfortable with them. Listen to them. You can be always a good peer counselor. You don't have to have a degree to be a counselor. I'm not saying that this is for the mental health professionals, but for a friend, to be the helping hand, to be the hand-holding person at that time of crisis. Our 3 days from the high, the next 2 to 3 days or maybe even longer is the lowest low where most of the people commit suicide, and nobody reports about it. Why? Does any queer person dying gets a sensation news? Any people who uses drugs dies, gets overdose on the road, nobody cares, nobody picks them up. So these are certain very small things which we always ignore. Like we are very good at ignoring. Like what I have seen is we are very good at ignoring. We always want more more data rather than evidences. So yeah, and coming to policies and youth engagement, as young person, what we can do is like young people are not funded. Youth organizations are not funded. That's very much fine. We don't want any funding from the government. But we as young person has the capacity, and we as young person has the enthusiasm to work, to engage in different programs where government is implementing the program. I have never asked any help from the government till now. And we have been running from last 2 years. And how are we running is, again, people ask, how are you sustaining yourself if you are not taking any help from the government? Because there are already so many schemes and programs which is run by the government, and we can always replicate that structure, and most of the services are free. So at least link, refer to all those services, and when our duty is when there is a blockage in the linkages and referrals with the system, we come there and we always advocate or the crisis intervention. We always do that. Yeah, one last point is like we always. This is a like very humble request from my side. Whoever is in the room, that at least please, whenever you work, I am one of the youngest persons still like talking here, and you are one of the most experienced person from all over the country and outside. This has been always in my mind that no, like the understanding of the intersectionality of violence, migration, like when in Manipur, there were no higher education facilities when I was growing up. We had to migrate to a separate place, different place, from where we have to set up our own thing. You are trying to figure out your sexuality, you are trying to figure out a new place, you are trying to make friends. There is so much of pressure in migration. We must be knowing. And again, what links is the sexual orientation, gender identity, and their access to services. We all have phone. Everyone has phone. But again, as mentioned, in Kashmir, 100 days was banned. Manipur is one place where it gets banned for every now and then. There is a small thing coming up for the state. It will be banned for a week. It will be banned for 2 days, 3 days. It's like sometimes we are not getting all those freedom to express. And I got a call from many people when I started speaking about it, saying like, are we promoting it? I don't have any structure. I don't have any structure means I don't have any support system for myself. Sometimes it's very difficult. Again, this one is that those person who are working on ground as an activist or into research or as a therapist, they do not have support sometimes. It should also be acknowledged that they are also people. They also get burned out. And for them, we need protection.
Saddam, yeah. I think you will
have
done. To wrap in half a second or so.
It's done.
Sorry.
It's done. It's the last slide.
Thank you so much.
Yeah. So this the last point is like most of the government. This one, it has been targeted interventions. Like government always work on targets. And what about those people who doesn't fall in the target? Like me, like many other people, and in Asia Pacific, like every 1 hour. 9 young people is infected by HIV. 3 adolescents. When we are sitting here and when you are listening to my talk, every 9 people has been infected by HIV. Every 1 hour, every 3 adolescents has been infected by HIV. Like that is the gap which we need to address. And it's not only about targets. It's about people as individuals as a whole. I'm a person first. If I don't belong to a targeted intervention, it doesn't mean I should not be getting any services. I have the full right to demand my right of health, education, and many other things. Yeah.
Thank you so much,
Thank you
Saddam.
so much. So
Brilliant.
that's
brilliant, and thank you so much.